Hello, everyone. The weekend before I started dental school, I went to a conference. It was a Joyce Meyer conference. And I didn't know that I was going to be faced with the story of a young lady that was part of one of her homes where she was housing and helping ladies that had children on their own that were single mothers and that were young. So she told the story of this lady who used to do drugs. She used to do meth, and so her smile was less than ideal. She had cavities all over, and thank God she was able to make her obtain the help of a dentist who restored her smile. And that was the weekend before I went to dental school. I didn't know anything about the tie between, drugs and oral health, but I understood that this lady was very withdrawn because of her smile. And after having benefited from the help of a dentist, it restored her self-esteem. And so I'm using this example or this story because I want to talk about the relationship between oral health and mental health and how having poor oral health can actually affect your mental health. So, as the story that I shared of this young lady, in my career, and we've been serving people for more than a decade, our patients, we've seen so many cases of people like that who, would have gone through, depression, anxiety because of the poor state of their oral health. They may have cavities, they may have gum disease, and so they end up being withdrawn or kind of depressed. They don't really want to show up, in public because they don't like their smile, the way their smile presents. And so that causes them, to become more withdrawn, as I said. So there's a relationship between oral health or poor oral health and self-esteem. I remember watching a show one time, and it was a lady that was really bubbly, but because she had so many missing teeth and such, she met a great guy who really loved her for who she was, but she was so withdrawn. Like, she didn't really want to go out on dates because she didn't want to smile in public or anything. Even though this man that was her fiance and that really wanted to, show her off to the world, she was really, really, really reserved. And it's only after seeking the help of the dentist that she was able to now smile all the time and, regain her confidence. So when you have poor oral health, it can actually affect your mental health. It can affect your self-esteem. You might be that person who just don't want to show off in public. I want to talk about many stories about the tie between oral health and mental health because that can, draw the message even further by seeing that it's many, many people that are affected by self-esteem. They lack self-esteem not because they don't feel that they're beautiful, but because they don't like their smile. I'm going to talk about one of my cousin's daughter as well, who she didn't have cavities, but the way that her teeth came out, they were very crowded. So needless to say that she was very reserved. She didn't really want to smile in public when she was younger until the day that her parents decided to actually get her braces or orthodontic treatment. And my cousin is there to tell me that the day that her mom told her that she was going to get her braces, she broke out in tears. She cried profusely and she was like, "Really, mom?" Like, she was like, so, like, touched. And from the time that she now had braces on, and even though her treatment is not yet completed, she is smiling from ear to ear, so it affected, and they didn't realize, that this child could have been more, joyful or more bubbly. And the reason why she was more withdrawn was because of her smile. So providing her with an alignment of her teeth just made her attitude and her personality shine, because she's just really like a very pleasant and very happy person. But it was the state of her teeth that caused her to be more withdrawn. I know someone else who had other issues, and it's because of grinding. And so, grinding her teeth and clenching and that's because of stress. Stress that can also be, one of the signs of having mental health issues. Stress, right? So, because of stress, the person was grinding their teeth so much that now it has affected the TMJ area. So now this person that used to be a person that would love to talk and tell stories, all of a sudden, right, is the type of person that, say, for example, you're talking to a friend and the friend knows her, and then you give her the phone. She's like, she doesn't want to talk. She doesn't want to talk because it hurts so much to talk. And even like the voice is not coming out very clearly, right? So because of that, she has become more and more withdrawn and more sad and even anxious, to show off in public or to even talk to the people that they know. And this person used to be a person that would talk to just about anyone, but now that person is more reserved, and that's due to the state of their oral health, the paroxysm. So stress and anxiety, fear of showing up, can be, caused by oral health issues. You now don't really like the way you show off. You don't like the way you appear. You don't like the way you feel. Even that can affect your mental health. Another thing that is oral health related would be pain. Say for instance, you have an infection or you have cavities and it's causing you great pain, and so that pain can also throw you in a spiral of depression. Another type of mental health. So that's, another way pain can actually induce, more oral health. I was going to talk about an example such as bad breath. I was at church, I think it was about 2 weeks ago, and one of my friends were just talking, and she said, Doc, I want you to help the people because some people, they don't realize even that they have bad breath, or halitosis. And they would be talking to you, and it's like, I'm like, can they not taste their breath? And I'm like, I don't know that you can taste it necessarily, but sometimes people are fully unaware of the fact that they have bad breath. And bad breath could be caused by gum disease, the fact that you have accumulated plaque and you have, bone loss and all of that, can actually cause you to harbor bad breath, that can be a reason. Or the fact that you're maybe like depressed and you're not really brushing your teeth properly can actually also induce bad breath, furthering that problem. So if somebody, and I know, like I always use the example of one of my aunt. We grew up in Congo, which is where I'm originally from. Back home, at the end of the day, after schoolwork and everything like that, we used to just love to gather, in the backyard and just talk, tell stories and just laugh and crack jokes and all of that. My aunt, because she suffered from bad breath along with, some cavities, she used to just, be very ashamed, of her smile. And whenever she would laugh, she would always cover her mouth. She was so self-conscious, because of, the bad breath that she had. So, yeah, that can also, exacerbate mental health. Now that she has had, her smile taken care of or treated, she has a beautiful smile. And those issues have resolved. She's no longer that withdrawn person. I'm not saying that every withdrawn people do suffer from oral health or mental health, but some of them do, and a lot of them do, right? So it's important to actually take care of your oral health because it would help your mental health. And I was going to also talk about this. There is definitely a correlation between oral health and the diseases such as Alzheimer. Research studies have shown that the inflammation that is caused by the bacteria in your mouth that causes gum disease can also, that inflammation can cross and go, to your brain, can also go to your heart. But as far as like your brain is concerned, they have found some mouth bacteria in the brain, and that exacerbates the state of the Alzheimer disease, right? So it is shown, or studies show that for older adults who actually suffer from gum disease, it would accelerate the neurodegeneration of the brain. So those people, they are at a higher risk of developing dementia, or the dementia to actually get to be activated even faster, right? In a faster rate. So all of those examples and stories today, I wanted to share with you so that you can know that there's a correlation between, and a negative correlation between poor oral health and mental health. Okay. That being said, there is hope, right? Because oral health can be improved. If you have gum disease, it can be treated. You have gingivitis, it's reversible. If you have periodontitis, which is the decrease of bone due to that inflammation at your gum on the bone that is holding your teeth, and that can cause mobility of your teeth, you can actually start getting what is called deep cleaning, and that can be maintained. You can even get some gum surgery to where, you are in a more healthy state, okay? So if you are that person who is suffering from oral health, please don't let it go and affect your mental health. Go and seek the help of a dentist such as I, and we will be able to intervene, become part of your journey, and so that you can actually, get a boost, a positive boost of your mental health, and that you can live your life in a more positive way, okay? And that you can actually regain your self-esteem, okay? So we're here to help you. If you're in need of a dentist, we want to work with you. Come work with us, okay? You matter. You deserve it. You deserve to have a beautiful smile. Be like that lady that came a couple years ago in our office who wanted to get married, and she came to get her smile restored. And it was just a few days before her wedding. We fixed her smile, and she left our office smiling from ear to ear. We want to do that for you, okay? We want to be a part of your wonderful journey as far as, improving your oral health and your oral health, and consequently your mental health. This month is mental health awareness, and that's the reason why I wanted to share that message. It is also the National Dental Care or Oral Care Awareness Month. So that is why we want to talk to you and also offer our open arms so that we can also be of help to you, okay, of help to you. That being said, Healing Wings Dental is my office. I'm the CEO and founder of it. We are located at 4101 West Green Oaks Boulevard, suite number 317 in Arlington, Texas. It's in the big Dallas-Fort Worth area. And you can give us a call at 972-213-0202. We will treat your smile like it's our own, okay? We want you to soar in life, and we are here to restore your oral health, help you maintain it so that you can soar in life, all right? That being said, we'll see you next time for another good talk about oral health and how you can better your life with your smile. Take care. Bye-bye.